Hi everyone, it's good you could join me today, and hopefully you are doing fine. So this morning I would like to discuss what an HIV is, what HIV infection is, and what AIDS is. HIV is defined as an infection that targets the immunity, an infection that destroys the immunity, an infection that affects the immune system of a living being. It causes the immunity to become deficient. If your immunity becomes deficient, it is unable to protect you or to protect me or anyone from different types of infections. It be TB, it be meningitis, pneumonia, bacterial infections, fungal infections, a number of infections will find access to your body because your immunity, which is supposed to defend you or anyone from a number of infections, it is compromised, it is deficient. So that is what HIV does. That is according to World Health Organization. A group of those infections are referred to as opportunistic infections. What is AIDS? AIDS is defined as last stage or end stage of HIV. It is also defined as one having any of the 20 infections which are life-threatening infections. So AIDS is defined as anyone having N of infection of the top 20 infection which are life-threatening infection. So in other words, we are saying AIDS is a group of infection that occurs in an HIV person. So that is what AIDS is. Now, a few points on how HIV is acquired. So HIV is acquired through unprotected sex with someone who is HIV positive, through sharing of sharps, especially in people that are drug users, especially drugs which are injectable. What else? STDs. STDs, these are sexually transmitted infections, and these infections may increase the chances of one getting the virus, especially those infections that are known to form ulcers may increase the chances of one getting HIV infection. STDs such as syphilis and chancre, they are the most culprits. Even other STDs would actually increase the chance of getting. What else? We are also being told that about 95% of HIV infections in pediatrics are mother to child related infections. So these are these are people that are a population that acquires HIV from its or from the mother. So when a woman is HIV positive and she becomes pregnant, especially when she's not suppressed, she is at a very high risk of transmitting the virus to the baby. What else? We are also being told that through blood transfusions, blood products, if blood is not thoroughly screened for HIV, the chances of the one who's receiving that blood may get the virus because it is in that blood. What else? We're also being told that those who practice anal sexual intercourse, are also at high risk of getting the virus. We are also being told that those who practice deep kisses, especially if they have sores in their mouth, they are at risk of getting the virus. Who else is at risk of getting the virus? Health practitioners, because they handle different types of patients with body fluids, so they are also at high risk. Soldiers, because of the nature of the work they do, they go away from home for so many years, and there they mingle with different people. They are also at high risk. Prostitutes and students in universities, they practice so many dangerous practices there. So they are also at high risk of contracting HIV. So those are some of the risks that may increase the chances of one getting HIV. How do you prevent from one getting this virus? One, you have to use condom. You have to know your partner's status. Blood should be screened before being transfused. Adequate treatment of STDs, and also avoiding anal sex. Those are important points that will help us prevent the transmission of HIV. And other points would include those who are HIV positive. They should adhere to treatment. They should be suppressed. It is also very, very important. As you know, someone who's suppressed may have reduced chances of transmitting to another partner. Let's also talk about using PrEP. PrEP is a preventive drug which is used before someone is exposed to HIV. You take PrEP every day, especially coupled with condoms, one has reduced chances of transmitting the infection. What else should we know? HIV management is managed with ARVs or ART treatment. These depends with what stage you are. Those on first line, they take one tablet either on TLE or on TLD. So that's how we manage HIV. How do you know that you're HIV positive? Just through an HIV test. So do an HIV test, then you start from there. When you're HIV positive, you start treatment. When you are negative, you'll be advised on how to live. So this is what I thought I could share with you this morning. Have a good day. Remember, subscribe to my YouTube. Let's mingle from there. Let's learn together, and let's encourage people in so many different ways. Be that person that changed somebody's life today. Be that person that encouraged someone who's living with HIV that they can do it and they can still enjoy the basic living activities rather of living just like a normal person. Let's not step on their toes, but let's help them reach their heights. Thank you so much. See you next time.